Hey everyone, welcome back to my channel. Thank you so much for joining me. As always, before we get started, if you could give me a like, share, thumbs up, comment, hit that subscribe and notification button, I would appreciate it. So today we're going to do something a little bit different with the Lindsay Clancy trial. I found a really good summary on Reddit, and I'm going to read that. If you prefer to hear the video, let me know, and we can always do that. The only thing is I'm not loving the audio quality. So that's why I figured maybe we'll try this, and it kind of gives you a roundabout of what happened and the key topics and things like that. Um, a lot of reading, but we'll see how this goes today. So let's get right into it. Yesterday was the cross-examination of the psychiatrist, and that was Dr. Tufts. And this was day 10. So, the backgrounds and qualifications of Dr. Tufts, and these are the major factual points summarized. Med school was University of Vermont from 2014 to 2018. Residency was Boston Medical Center from 2018 to 2022. She was board certified September 12th, 2022. Began independent practice at Astor Mental Health August 22. Treated 50 postpartum patients during residency. None for postpartum psychosis in first month at Astor. That's important. The second is advertising and expertise. The defense challenges her website listing special interest in perinatal psychiatry. Tufts denies calling herself an expert, states it was listed as an interest. Number 3, intake process and telemedicine. All 14 appointments with Lindsay were telemedicine. Defense emphasizes inability to observe full body cues, hands, legs, agitation. Tufts states she could still assess appearance, affect, speech, and thought processes. Number 4, September 15th intake initial complaint. Lindsay reported postpartum anxiety. PHQ-9 used instead of Edinburgh Postnatal Depression Scale, which is the practice policy. Number 5, Zoloft prescription and adverse reaction. Zoloft 25 mg prescribed, instructed to increase to 50 mg after 1 week. Lindsay waited a month due to fear of side effects. Upon increasing dose, Lindsay reported insomnia, diarrhea, GI upset, mental fog, crying all day, increased anxiety, depressed mood, paranoid fear of getting suicidal thoughts, and not wanting to be alone. Tufts instructed her to stop Zoloft immediately. Number 6, the October 20th to 26th period. Lindsay's mother came to stay due to severity of symptoms. Defense presses Tufts for not contacting family. Tufts states Lindsay was an adult capable of advocating for herself. Medications that were added during this time: Ativan, which is a benzo, buspirone, hydroxyzine, and Benadryl used as needed by Lindsay. The defense challenges polypharmacy and lack of documentation on Benadryl dosing. Number 7, suicidal ideation. The defense emphasizes Lindsay's statement, quote unquote, close to suicidal thoughts, quote unquote, paranoid of getting suicidal thoughts, quote unquote, something bad might happen. Tufts distinguishes fear of suicidal thoughts from actual suicide ideation. Number 8, South Shore Perinatal Clinic. Lindsay saw outside providers. Tufts did not obtain records. Defense challenges failure to request HIPAA release. Number 9, emergency department visits. Lindsay went to MGH ER for depression, and she was not admitted. Number 10, McLean Hospital. Lindsay was admitted to McLean, which was the locked unit, for 4.5 days. Discharge summary faxed. Tufts did not obtain full records. Seroquel discontinued at McLean. Number 11, January medication changes. January 9th, diazepam prescribed. January 12th, trazodone increased to 150 milligrams. January 16th, amitriptyline added. Lindsay reported very low mood, numbness, forced bonding with baby, poor sleep, and no motivation. Number 12, January 23rd, which was the day before the incident, Lindsay reported depressed mood, flat affect, racing heart, numbness, no emotion for around 17 days, and no motivation. Tufts increased the amitriptyline. Defense asserts this pushed her over the edge. The Commonwealth had a redirect examination. So these are the major factual points for that. Tufts treated thousands of psychiatric patients during residency. 1 year perinatal elective, extensive postpartum experience. Telehealth is standard, does not impair psychiatric assessment. The PHQ-9 was appropriate because postpartum depression shares symptoms with major depression. Lindsay consistently denied actual suicide ideation until December 1st. Fear of suicidal thoughts does not equal suicidal ideation. Protective factors. Lindsay sought help, scheduled appointments, went to the ER, and arranged for maternal support. No signs of psychosis or mania was ever observed. Seroquel discussion initiated by Lindsay and her husband. Depression present before and after Seroquel, not caused by it. Lindsay demonstrated medical sophistication and accurate recall of medications. If Lindsay had expressed intent or plan to harm herself or children, Tufts would have initiated Section 12 involuntary commitment. The exhibits that were referenced was Exhibit 219, and that's Tufts medical records, which was the intake forms and progress notes. And nothing more was admitted. And the other thing that I wanted to go over, this I thought was really interesting. Let me find it. Okay, so this was an FYI, and it said this is her current bio on the practice website. Let's see what you guys think. Dr. Tufts is a psychiatrist who attended medical school at the University of Vermont and completed her residency training at Boston University. She employs a multidimensional treatment approach that utilizes tools such as medication, psychotherapy, mindfulness, and lifestyle changes. Dr. Tufts' areas of specialties include PTSD and trauma-related disorders, mood disorders, anxiety, OCD, ADHD, and substance abuse. She has a particular interest in women's mental health and perinatal psychiatry from pregnancy through 2 years postpartum. Areas of expertise: anxiety, depression disorders, bipolar spectrum disorders, and other mood disorders, women's mental health, perinatal psychiatry, trauma-related disorders, and ADHD. Treatment modalities: psychiatric evaluations, medication management, supportive psychotherapy, transcranial magnetic stimulator, which is a TMS, intranasal esketamine, which is Spravato. And this poster put, if I read that, I would think I'd be in good hands. In fact, I'd probably search out doctors that have those keywords in their bio, so I know they might understand me and treat me appropriately and personally. So that is the roundabout on how day 10 went with her psychiatrist. That was the first part. And then this was the second part. So Reddington, and that is Lindsay's lawyer. Reddington inquires about school shootings and lawsuits arising from SSRIs. Tufts not aware of that link. The question was asked, when you met again, did you recommend increasing? Tufts doesn't think so. Reddington says Lindsay went, quote unquote, off the rails following increased dosage. Tufts said she didn't use those words. Quote unquote, she felt awful. Anxiety, stomach issues, depression, can't sleep. Tufts recommended stopping the medication. Did Tufts ever gauge Lindsay's knowledge on which medication would be good for her? She says yes. Excuse me. Did Lindsay have prior issues with her prior kids? Tufts said she knew she had anxiety symptoms after her second child, Dawson. She knows Dawson was a few years old. She recalls Lindsay having common temporary side effects. She thinks Lindsay took Zoloft for a week after Dawson's birth. They discuss bipolar. Reddington asks about prescribing an SSRI to someone who has had a difficult birth and is bipolar. Mental problems after second child, mental problems after third child. People get embarrassed about having mental problems, don't they? Tufts agreed. Do you think you should have documented the side effects she had with Zoloft since you were prescribing it a second time? Tufts does not feel it was necessary. Reddington points out she does not know for sure what the side effects are because she didn't write them down. October to November 2022, Lindsay was overwhelmed. Not just overwhelmed with children, she was really struggling. Tufts agrees. Did Tufts give Lindsay therapy at the time she told her to stop Zoloft? Yes. What did she do? Tufts asked which day. Reddington doesn't necessarily clarify. Did she tell you in November 2022? Did she mention feeling suicidal? Tufts needs to look at the records to clarify date, but does recall it was a while before she mentioned feeling suicidal. December 1st, quote unquote, denied feeling suicidal but was close to it. So she was dwelling on it? Tufts says she was fearful of it. How long did she have these thoughts? She doesn't know. She doesn't have it documented, but she usually asks. Do patients worry about losing their kids for admitting to suicidal and homicidal thoughts? He points out that Tufts is a mandated reporter. Tufts says suicidal thoughts aren't exactly a reportable condition. What did she do with the psychotherapy? She provided emotional support and validation. What words did she use for Lindsay? She's not sure. And we're actually going to go back to the beginning of this, and then we will end it here. Um, the one thing that I saw at the beginning of this was, if you're not following this trial and you want a quick rundown of how it's going and what it's about, I'm going to read this to you. So this was before the trial actually began. So it says, opening statements begin Monday for Massachusetts mom Lindsay Clancy after she killed her 3 young children inside the family's home in January 2023 before attempting to take her own life. Cora, 5, Dawson, 3, and Callan, 8 months, were found with exercise bands around their necks. Prosecutors contend Clancy intentionally strangled the children, while her defense argues she was suffering from severe postpartum depression and psychosis that left her unable to understand her actions. Jurors are expected to hear testimony from medical experts, investigators, and family members as they determine whether Clancy is criminally responsible for her children's deaths. So, that is that. Let me know if you would prefer that. We got that done in a little over 15 minutes. But like I said, if you would like to hear the actual video and the audio, we can do that. Like I said, I'm just not loving the way the audio is sounding, and I don't know if it's my microphone or it's because I'm recording off of my phone. I'm not sure. I'm still figuring the kinks out, but let me know what you prefer. And whatever you guys want to do, I will be more than happy to do it. So, all right, I will get this uploaded and we will talk soon. Thanks for joining me, guys. Bye. Have a great day.